Yes. So yesterday I have posted a question. This is our case 4 here. A 47-year-old black female with no past medical history. They presented to the ED accompanied by her husband. Her husband complains that the patient has been acting differently lately. Normally ladies act differently, but this is a pathology scenario, right? The patient additionally complains difficulty feeling her phone when it's ringing. So there is something about a sensory, right? There is something about a neurological deficit. So what it indicates exactly? There is a neurological deficit, right? A peripheral smear is obtained in the picture below. Laboratory results are hemoglobin 7.1. The normal reference value is given here 12 to 15. So hemoglobin is decreased. So we are thinking about what? An anemia scenario. The mean corpuscular volume reference 80 to 96. Here more. So the MCV is high, right? Then the figure is also mentioned. Can you see here? What is this? This is the hypersegmented what? Neutrophils. Hypersegmented neutrophils. So MCV high, hypersegmented neutrophils we are having, patient is having anemia. Wherever you see MCV high or hypersegmented neutrophil, we think about macrocytic or megaloblastic anemia. Macrocytic megaloblastic anemia. Agreed? Macrocytic megaloblastic anemia. We think about two things only. What is it? Either it is vitamin B12 deficiency or vitamin B9. Vitamin B12 or B9, right? In vitamin B12 or B9, remember both the cases MCV will be high. MCV will be more than normal. So it is given here more than 9600. So both the cases MCV will be what? High in B12 and B9. In both the cases, you will see biochemistry, homocysteine. Homocysteine will be what? High in B12 as well as B9. So MCV as well as homocysteine is common for what? B12 and B9. Now, in B12 and B9, you will have, so that will cause you what? Which anemia? Macrocytic megaloblastic anemia. So, what is the thing that is prominent or relevant only for B12? B12 is responsible for myelin sheath. So, neurological symptom is only for what? B12. Right? In B9, we don't have what symptoms? Neurological symptoms. So, in this question, as she has problem with hearing or ringing the phone, they are talking about neurological deficits. So, we understood this is a megaloblastic macrocytic anemia with a neurological deficit. What is it? B12 deficiency. What is it? So, what is B12? Silent cobalamin. Many of the people have chosen the answer very direct. Yeah, B12. So, the answer will be what? B12. They will choose like this. But is it correct or not? No one will ask this direct question to us. The people who have chosen this, you have to understand, even B12 is less in the body. If you check B12, you can see false normal. They can be false normal. In which people? People who are having some liver disease or myeloproliferative disorder or some renal disease. In these disease people, even though their body has less B12, when I check the level of B12, it looks normal because liver produces it. In myeloproliferation, the stored form from the liver or from the bone marrow, they will come out. Agreed? So if I check B12, it can be normal, but reality what is it? B12 is what? Decreased. So what is a golden marker? We can confirm whether someone has B12 deficiency or not. That is known as MMA. What is MMA? Methyl malonic acid. We will check it. We can't see in B9. So if you don't want any doubt whether it is false or true or whatever, what is a golden marker we always check for vitamin B12 deficiency? What is the correct answer? Methyl malonic acid. Homocysteine is common for B9 and B12. And the intrinsic factor, that is pernicious anemia, antibody attacking. Nothing about given here, right? Is irrelevant here. Which is not B9, we know, because there is what? Neurological deficit. So we never choose what? B12. To check B12 deficiency, we check what? MMA. So what's the golden marker for vitamin B12 deficiency? Methyl malonic acid. Done? Lifetime.